morning and welcome to Apollo 24/7's Health Hour. Health Hour, as you all know, is an every week edition where we bring you experts from Apollo hospitals live to the show and you can ask all the questions and queries that you have been postponing. If the visit to a gastroenterologist is due and you have a few questions to be asked even before you make that physical visit, here's an opportunity where you can type your question in the chat box of YouTube. You are watching this on Facebook and Instagram pages of Apollo 24/7 as well as my Facebook. But if you have a question to be asked to our expert today, please hop on to the YouTube chat and ask your question there. Type your question and I shall be reading out the question. And while you type your question, may I request my audience to type all possible parameters of the question like your age, gender, कब से आपको प्रॉब्लम है, क्या प्रॉब्लम है, क्या लेते हो, and all other parameters also into it. Also on the show, we do have a health quiz where you can win prizes from Apollo 24/7. And I'm going to share some discount vouchers which you can be using on the app. तो पहले आप एक काम कीजिए, अगर आपके पास ऐप है, it's wonderful. अगर आपके पास ऐप है और सर्कल मेंबरशिप नहीं है, it makes a lot of sense to have the circle membership too. So go ahead, download Apollo 24/7 app. And today we are going to talk something which is the most commonly found problem in a human being, gas and acidity. ऐसा एक आदमी को मुझे दिखाओ कि गैस के साथ ना सफर करे, कभी ना कभी बच्चों से लेकर बड़ों तक we have gone through this problem. So let's understand what the causes and cure of gas and acidity are. Today we have the specialist Dr. A. Bharath Kumar, and he's a senior gastroenterologist and therapeutic endoscopist at Apollo Hospitals Jubilee Hills, Hyderabad, with more than 9 years plus experience. He specializes in the treatment of pancreatic diseases, biliary tract diseases, liver diseases, inflammatory bowel disease, and irritable bowel syndrome, dyspepsia, altered bowel habits, GI bleeding, cancers of the GI tract, and the Gerd, gastroesophageal reflux disease as well. He's published papers and he's very well awarded as well. Let me welcome Dr. A. Bharath Kumar. Good morning, namaskar, welcome to the show.
Good morning, madam.
Welcome again. So it's wonderful having you here on a Sunday morning, Dr. Bharath. As I've just said, thank you. As I've just said, ऐसा आदमी कोई नहीं होगा जो बचपन से लेकर बुढ़ापे तक some time or the other that we have gone through this. So let's understand, if gas and acidity, the terms that we loosely use, are these normal for our body? What is normal, what is abnormal, and what is a cause of concern?
Yes, ma'am. So the problem of acidity and gas, this acid reflux, these are normal things for everybody in all ages, across all ages and gender. The thing is common, but then these things are transient. It can come and go in between. It depends on environmental factors. It depends on our diet. It
Right.
depends upon our lifestyle, mood. Lot of factors are there. So when it becomes abnormal, when we need to worry about that thing, how we can manage it at our home only, when should we consult our physician or gastroenterologist, and when should we get evaluated. So all these things we'll discuss today and get some idea about these things. I'll be happy to share about some of these things. Yeah.
Great. And I know by the number of messages that I have in the chat box that this is not a simple issue. The gravity of the issue is so much. If it's not a very serious problem, but still people are suffering from it. What kind of questions that I have today? Most of the questions are overlapping as you see in the chat box. I think we will group the questions. I'll take a simple question first of understanding. Burping is normal, as you said. These are very normal activities of our body. But if you are constantly burping, if you are belching, what does that mean?
So there are two reasons why excessive belching can happen. One is called supradiaphragmatic belching. So where the belching is the air which we swallow. It's not coming from manufactured inside. So this is predominantly seen in people who are anxious. There's a lot of they're a lot of stressed and they're very anxious. They kind of have this habit of swallowing air without their knowledge. They try to clear the throat and keep swallowing air. That air gets accumulated in the food pipe and it comes back. That's called supradiaphragmatic belching. So this thing is predominantly is managed by relaxation and some training of breathing, and keeping them conscious of what they are doing, making them aware. No amount of medications and evaluation will help them. The second reason for belching is excess formation of gas in the intestines and stomach. This is because of the type of food which we take. So there's a
Okay.
thing called FODMAP, diet FODMAP, where these are the things which cause excess of gas formation. So all the food items can be classified into items which cause less gas and items which cause more gas. Okay. So I'll discuss in detail in
Right.
the next subsequently when we discover the bloating
Sure,
and all this
doctor.
stuff.
That will be wonderful if you can just let us know which food can cause excessive gas. बनाए रखिएगा अपना interest because Dr. Bharath is going to share with us the food groups that can cause you excessive gas in a while. So next question that I want to take up is a registered user's question. What causes gas or acidity? जैसे आपने अभी बताया कि anxious people can have certain issues. So if you can majorly touch base on what are the major reasons.
So major reasons are classified into items which cause excessive acid formation. So acid formation is basically is proportionate to the amount of fat intake or oil intake. So when your diet consists of excess of oil, ghee, butter, cheese, these kind of things, so they take a lot of time for digestion, and they also stimulate the intestinal secretions a lot. So foods which contain moderate amount of oil, for example, the limit is around 500 ml of oil intake per month. That's the limit for a healthy person.
500 ml per
Um,
month
per month per person.
per
That's
person.
the healthy. Yeah, it doesn't depend upon type of oil, but more importantly is the amount of oil which we take.
Okay.
Uh, so that it is a major determining factor. Second thing
If I
is
take one vada and
yeah,
squeeze, I can
yeah.
easily get at least 25
One,
ml of oil per
yeah,
vada.
yeah. So you can take it. We have to limit it like once a week or once in a fortnight, like that. All your puri,
Right.
vada, all these things contain excess oil. The second thing is excess
Yeah.
spice and sour foods.
Hmm.
So anything which contains a lot of citrus and sour, they stimulate acid secretions a lot. So for
Right.
example, you take citrus fruits like lemon, orange, mosambi, amla. So even though they are good for health, they contain a lot of vitamins and nutrients. They cause a lot of acidity and acid reflux. Those who are suffering from this problem, they need to reduce these things. Those who have no problem, they
Yeah.
can consume in moderation.
Right. Right. Right.
The third thing
So
is
here
meal.
they are. Yeah. Please continue, doctor. Third thing
Third
is.
thing is the meal portion. So one
Hmm.
basic principle is to take around 50 to 60% of your capacity. That's the limit. If you consume more than that thing, it takes a lot of time for digestion, and it causes bloating, excessive discomfort, belching, all these things.
Hmm. Hmm. Hmm.
So
Hmm. So yeah, now I want to get into the audience's questions. So I'll take one after other, and I might group the questions also into things that fall into one genre. So gas and heart pain in chest, a little facts. He says that, and how do we understand it is cardiac issue? Anik Nayak puchte hai. I have gas stuck for more than 1 hour. Is it a cardio issue or a gastro issue? Which is a very common, problem that people cannot identify which pain is this. The pain is that bad. That means. So can you
it's
please throw some light here?
a very good question, because a lot of people come to the emergency or go to the cardiologist. Some people come with family history of some cardiac event in their family, and they're very scared about that thing. Their mind goes to the heart. So in
Correct.
that case, what we do is we try to, from the history, we try to identify if it's a cardiac thing or a gastro esophageal reflux, acid reflux. So the main thing is the pain which comes in the center of the chest, which is like a heaviness, which radiates to the left arm, which causes a lot of sweating, perspiration, breathing difficulty. This is cardiac. So the pain which is from acid reflux is also located in the center, but it's more like a burning pain, and there is a lot of sour liquid which is coming back into the throat, regurgitation.
Okay.
It can radiate to the back or neck, but usually it doesn't go to the left arm, and it's generally
Okay.
not associated with sweating or shortness of breath. These things are not there. So
Okay.
for example, if a young guy or young lady comes with some chest pain, some people complain that pain is on the heart, on the left side. So cardiac pain never comes on the heart. It doesn't come on the left side. It always is in the center, like a heaviness. So somebody who is young, without any diabetes, hypertension, or predisposing factors. And if the pain is lasting for a long time, they are having a lot of sour liquid coming back. So this we can safely conclude that it's acid reflux pain to start with.
Right. Right. So, when somebody asks that more than 1 hour unko ye pain rehta hai, so what is something that they immediately have to do at home, and what is it that they have to do to evaluate? What any tests that you recommend first, or anything that you suggest that you stay away from these for a few days and then try?
So I mean, it's a good thing. So if somebody has a chest pain or acid reflux kind of sensation, the most important thing is to identify what is the risk of having a cardiac event. So if they are they
Okay.
diabetic, are they hypertensive, are they having any previous cardiac problem? In their
Right.
family members, does anybody have a cardiac event in age less than 45 years in their family? So if all these things are checked out, they're not there, then actually the assumption is most likely to be a acidity pain. So in that scenario, what we need to do is we need to take some food items which contain natural antacids. For example, cucumber.
Oh,
Cucumber contains a lot of natural antacids. Carrots, cucumber, uh, banana, ripe banana. So these contain natural antacids. So they should also drink a lot of water, around, for example, 2 to 3 liters of water per day. So if you take a lot of water, drink some natural remedies which contain some kind of antacids, natural antacids, it may cause some relief transiently. In the next subsequent meals, they need to reduce their oil intake and sour foods, intake of sour foods, and try and see if that makes any improvement in their symptoms. If it's
okay.
persistent and if it's not improving with these little changes in diet, then probably they need to consult somebody and take some medications for the time being,
Right.
and then
So
get
I
back to
think
diet.
that's a great, yes, that's something that you can do at first hand, that you can control. When is it a red flag that it is beyond your control and you got to visit your gastroenterologist? And people do get scared. आपका नाम सुनते थोड़ा डरते हैं sir. Let me tell you that, because आप लोग especially endoscopist से तो मैं तो डरती हूँ, because you put a pipe inside, and that's what, that fear postpones my visit to a gastroenterologist till the time that it is unbearable.
Yeah,
So, what do you advise? Okay, the
yeah.
moment you hear that you are an endoscopist, don't fear and run away, is what my thing is.
That's a genuine concern for most of the people who make it a point to come to the hospital. Also, in their mind, they have this care of endoscopy. So first thing is to remove that fear from their mind. So
Ji.
the most of the people actually don't require an endoscopy. So by following some basic remedies, most of them they can control symptoms. The next step two is to take some medications for symptomatic relief. Then in a selective group of people, we advise some evaluation tests which also includes endoscopy. So the red flags are the important subset of people who require evaluation are those who are aged more than 50 years, number one.
Okay.
Number two, the symptoms are long standing. They are, for example, more than 4 weeks in duration. The third thing is those who have difficulty in swallowing. When there is difficulty in swallowing food, it means that there is something obstructing in the food pipe, or there is some damage that has happened inside. There is something that's causing mechanical obstruction, which causes difficulty in intake of solid food. The fourth thing is if they have noticed recent changes in appetite, they have lost appetite or they have lost few kilos of weight, that's when it's a concerning thing. Fifth thing is that any of their family members have a gastrointestinal cancer,
Okay.
or they have developed bleeding, either blood in vomiting or black motion stools, or blood in stools. So all these six features, these are called alarm symptoms. So when somebody has alarm symptoms, then they definitely need to consult a physician or gastroenterologist.
Yeah. पूर्वापाल जी, आप इतने बार क्वेश्चन पूछ रहे हैं, पर मैं ये क्वेश्चन नहीं ले सकती हूँ क्योंकि ये एलोपैथिक रिलेटेड प्रोग्राम है। आपने जो पूछा है वो आयुर्वेदिक या नेचुरल थेरेपी के बारे में है। मैं वो क्वेश्चन यहाँ पर नहीं ले सकती हूँ। थैंक यू सो मच। कुछ और क्वेश्चन है तो ज़रूर पूछिएगा। थैंक यू सर। नेक्स्ट क्वेश्चन दैट आई वुड वांट टू टेक अप इज मिस्टर अश्विन श्रीवास्तव's क्वेश्चन। आपने बोला था कि banana is okay to has certain amount of anti
Acid. Antacid.
anti-acidic antacid. Yeah. So Ashwin Srivas says, can eating banana on an empty stomach cause belching? If I eat a banana on empty stomach, I get a lot of belching with the smell of banana from the gas. That is his one question. But other question that he also has a kind of acidity for a very long time, from actually from COVID, the lockdown that he has been experiencing acidity. He's been consulting a gastroenterologist from Chennai, Dr. Hariharan, but despite being on medication, even if I leave the medication for 2 or 3 days, my acidity comes back very stronger. And right now, he's taking Sompras and EcoGut 100 as per the advice of a gastroenterologist.
Yeah, sure. So the I've got an idea of your problem. So the thing is, the best item to take in an empty stomach is to take some milk and milk products. Those who are not allergic to milk and milk products, that's the best thing to start. So
Okay.
ideally, the fruits are recommended around 1 hour after a major meal. For
Right.
example, some people like to have it after breakfast, some people like to have it after lunch or dinner. So give a gap of around 1 hour and then take some fruits. That's the best thing to take, best timing to take. So, and what fruits to take? If you have a lot of bloating and belching, then sudden foods like watermelon, banana, these can cause a lot of bloating. So some fruits like strawberries, pineapple, kiwis, these are good. Papaya, they don't cause so much of bloating and belching.
Right. So the question that he has asked is about, he's been continuing on his medications,
Yeah.
and even if he starts for a day or two, it comes back stronger. And in the same lines of question, may I also ask Shobha Kumar's question? I have acidity from 20 years. I take a Rantac every day, and how long can I take it? I get belching if I don't take a Rantac.
Yeah, it's a very important question. The thing is that most of the people have something called functional dyspepsia, where there is some disturbance in the intestinal function rather than the structure of the intestine. So, for example, if you do all the tests in the world, they all will come as normal for them, because there is some disturbance in the way our system is processing the food and the type of food we are taking, like that. So we have to address a lot of things. It's not just purely pharmacological treatment in acidity. So we
Right.
should stick to a diet which suits us. So there are some trigger foods which cause these symptoms. That's different in each person. So some things which may be
Right.
very good, like banana, they may cause a lot of bloating, like in Ashwin's case. So we need to tailor the food according to the person's symptoms and his lifestyle, his genetic makeup also. So we need to consult a dietitian or nutritionist to make a diet plan for us. So what should take in breakfast, lunch, and dinner, and what amount of energy we need. We need to make a diet plan. The second question is about the medicines and relapse of symptoms after stopping medicines. That's a very important thing. So it happens with any kind of antacid medication like Rantac or pantoprazole, esomeprazole. The thing is that mechanism of action is to block the secretion of acid from the stomach. So when we block the secretion, it acts for a certain period of time, let's say 12 to 24 hours. So after that, it causes complete blockage of the acid production. So when we take it for a significant period of time, say more than 4 weeks, then what happens is that the receptors get very upregulated. The number of receptors increase in number, and so their capacity to secrete acid becomes very high. So we have kept it at a check like that. So once we release
Right.
the check, so immediately, like it's like a dam and all the fluid is inside. So when you keep the check out,
Like,
it bursts out like that. So there's rebound hyperacidity. So when somebody has taken antacid medication for a significant period of time, we should gradually taper the medication rather than abruptly stop it. So that's called dependency
correct.
with the medicine. So it's a very common thing with people continue to take this medicine for years together. So it's actually it was considered to be safe in the past, but then a lot of recent scientific evidence is there to show that it has a lot of side effects. It can weaken the bones, it can cause vitamin deficiencies, it can actually cause kidney problems. So all these problems put together. So we need to take it only whenever necessary. It's not to be sustained like that. So we need to gradually taper the dose and stop. Maybe take in half
Right.
doses for some time, then take it alternate day for some time, and then stop.
All right. So this is something very, very important and something new that I'm hearing, Mr. Bharat, because this is almost like a steroid that you have used for a very long time, and you can't suddenly stop a steroid.
Yeah, exactly.
And these medicines, especially anything related to gas and acidity, are over the counter,
Yeah,
easily
exactly.
available.
Yeah.
आपसे पूछे बिना भी हम लोग जाके ले लेते हैं, जिनमें से मैं भी एक हूँ. मैं खुद को अलग नहीं करना चाहती हूँ, but yeah, but what about the availability and this lack of knowledge that we tend to take medication?
So, I mean, they are available over the counter, unlike in the Western countries where it's prescribed only with in consultation with the physician or somebody. So, availability is one issue. Second thing is a lot of brands are available. Some counterfeit products, some products which have lesser efficacy than they are presumed to give. Third thing is prescription by quacks and somebody who is not qualified to prescribe. So they can keep on writing them. These prescriptions also are very common with non-gastrointestinal specialists. So
Right, right.
they may, because they may be specialized in a particular area, but then they may not be having a lot of data and understanding about these medications. So they just keep on prescribing, and these people will be taking continuously. So they also have an
So,
effect of in the absorption of other medicines also. Like somebody may be taking some other important medicines, and these people, the medicines may interact and decrease their absorption. That's another problem with them.
right. Okay. So, next question that I would want to move on to is Sonia's question. I eat a healthy portion controlled food, but during the evening I get a lot of burps. And what tests can be done to check for gut issues? Lot of burps, and also a lot of people are asking about, though we are eating healthy, though we are walking, they do get burps, and which is out of control and what is normal.
So I mean, verbs which are excessive in number and which cause disturbance in the quality of life. The way they are saying, it's already affecting their quality of life. They have become conscious of that thing. So general healthy person, they are
Correct.
not aware of. They are not bothered about that thing. If it becomes bothersome, there are issues that we need to address. So one thing is first thing again coming back to the basic thing about diet. So basically, we have over a period of time we have classified all the food items into low gas forming items and high gas forming items. So it's called FODMAP technically. So anybody actually can Google and see FODMAP. So low FODMAP diet causes less gas formation. So we classify all the grains, cereals, fruits, nuts. For example, if you take nuts, which are considered most benign and healthy things, so cashews and almonds cause a lot of gas, while
Correct.
pistachios they cause a lot of gas, while walnuts they cause very less gas. So walnuts also have less amount of fat and more amount of protein. So always prefer to dates also are good. So dates, walnuts they are good, while pistachios, cashews and almonds they can cause a lot of gas. So it's again individualized, but then we need to make a chart of things which are good and not good.
So my question here, doctor, is the FODMAP guide, is it only for people who have gas and acidity as a problem,
Yeah.
or somebody like, otherwise healthy person like me also has to follow a low
Yeah. So it's not a it's a strict thing for those who have a lot of bloating and belching. For healthy people who don't have significant bothersome gastrointestinal symptoms, they can always choose. For example, onion and garlic are considered very good for health in general. But then both of them cause a lot of bloating and acidity. They are high FODMAP
Correct.
diet. So if you
Right.
we actually have to do something like a experiment and see. Each person is different. So take a
Correct.
2 week challenge and see. Try to avoid some items and see. So if your general well-being improves than what you are right now, it's good for you. For healthy persons, that's the thing I would advise.
I'm so seriously impressed with Dr. Bharat's FODMAP sensitivity, because not many of the gastroenterologists do talk about food in detail, especially understanding FODMAP and then removing it, introducing it. This gets into a different genre from what you practice. So it takes effort, and I appreciate you, Dr. Bharat, for giving us this insight here. Yeah. Next question that I would want to take up is Mrityunjay Mishra, who gets a headache and acidity if they don't eat on time. But this is not a problem for many people. They can go for a long time without eating and they're fine. So hunger and acid with headache. What's the connection?
So basically, for those who have diabetes, their sugars are very sensitive. They can go up and down like anything. So in them, actually, symptoms of hypoglycemia this can happen. For those who are non-diabetics, the correlation between the symptoms is vague. So some people tolerate lack of meal or fasting very good, because their mind is absorbed in some other thing. Most common reason is for good health, or some people for devotion or spiritual reasons they do fasting. So they tolerate it very well. For somebody who is not doing like that, they are forced to fast. Their mind is absorbed in this thing, so they have a propensity to develop a lot of symptoms. So some people are they have to meet their calories on time. So each person is different. So somebody who is very sensitive to fasting, lack of food, or if they don't meet their calorie intake on time, they have a lot of symptoms. So there's another thing to explain in this one. So people with acidity and disturbances of intestinal function, they have a lot of things which are not directly correlated with intestinal thing. They are called extra intestinal symptoms. These are called, most common reason for these symptoms is they are anxious, they are stressed out. So that we need to address whether the intake is because of less calories, which is not going on time. Second thing is the type of food which we are taking. Third thing is, are we too sensitive? People
Gee.
with very high sensitivity, they have a lot of symptoms in the body, which includes headache. So some people also can have migraine or some other problem, which may be triggered by fasting. That also we need to identify.
Right. So here's Dr. Vishnu Swarup Chandravamshi. He's diabetic and taking insulin and some medicines as suggested by doctors. The gas and acidity is formed by the medicines that I'm taking. Is that a possibility that you also react to the medications of some other problem?
Yeah, it's a very important problem, Jansi. So, Dr. Vishnu, the thing is that some medicines are very clear cutly associated with the development of acidity and ulcer formation. For example, some painkiller medications which are available over the counter are prescribed by orthopedic people, or the doctors who deal with joint problems. They prescribe a lot of analgesics. So these cause blockage of prostaglandins. So and they cause excess acidity formation and tendency to develop ulcers. So this is the most common medicine which can cause acidity. The second kind of things are those medicines which are swallowed without insufficient water. For example, something like alendronate, something to increase the bone strength. If you don't take adequate water with that thing, they can cause esophageal ulcers and they can cause symptoms. Some medications like iron or potassium supplementation, these can also cause a lot of gastritis and acidity problems.
Okay. So, for most of the antibiotics which are commonly prescribed for other reasons, they do come with a prescription of an antacid as well, or any of these Rantac or pantoprazole. So, is it mandatory to take?
So it's not mandatory, madam. So the antibiotics, most common problem with antibiotics is they change the type of bacteria in the intestine. They also destroy a lot of good bacteria in the gut, so they can cause diarrhea. That's the most common problem with antibiotics. So second problem is development of acidity, nausea, vomiting, like that. So we don't need to prescribe as a blanket thing for everybody. It depends upon each person. For example, if you're taking a lot of antibiotics like tuberculosis medicines, which includes combination of four antibiotics at the same time. So for them,
Yeah.
actually, for them also, there is no scientific data to prescribe antacid along with that thing. But if somebody, we anticipate that they may be sensitive and they may develop symptoms, or if they complain after the next visit, then we start on antacids.
Yes. So here's Mr. Rajendra's question. Lack of sleep or the timing of the sleep, does this lead to acidity? What it doesn't, does it? Why does it lead to acidity? What should we do to take care of yourselves on the day that you're traveling on the road and not getting enough sleep?
Yeah, it's an important question. So, sleep and having a relaxed mind is very important for gut health. So, it's something called gut brain axis, where your mind has a control on the intestinal function. So, there are a lot of neurotransmitters, hormones, which are influenced by our mind's function. So, if somebody is not getting sound sleep of at least 5 to 6 hours per day, or if they are bothered about something in their life, there are a lot of stressors are there, or they're depressed. They can affect the intestinal function in a varied ways. Some people can have a lot of belching, bloating, acid reflux. Some people can have constipation. Some people can have diarrhea. Some people can have bloating. So this thing needs to be addressed as a very important thing in people who say that they are not responding to medications. They have changed the diet. They are not responding. We need to address this third factor of mind.
Mm.
So
Right, but
again,
then our
fix.
work, the kind of work that the world that we've moved on to, the night shifts, the continuous shifts, the stressful jobs, and the long travel jobs, the long air travel jobs, the long road travel jobs, or any other recreational travel also. Our circadian rhythm is badly broken. So does
Correct.
that also have any impact?
It has. So, because our body has something called circadian rhythm, uh, we are tuned to sleeping at night, working in the morning. So that's why our mind and body are designed to function. So, for example, if we are doing a night shift, uh, those who are compassionate and good employees, they compensate that thing with giving a leave for next day, or giving less work in the next day morning, or doing something like that to preserve their mental well-being. So those, if you are, for example, if you are a trainee, or where you don't have too much control on the thing, then we need to make some adjustments in our own life to relax, get adequate relaxation the next day morning. So at least we should ensure that in a day's time, in case we are not able to sleep at night, we need to sleep at least 6 hours in the day. Those who have night shifts, and to change our to get a balance in the circadian rhythm. So if possible,
Right.
the best
So
thing is
now
yeah, fix to a
coming
regime.
back to Rajan, sorry. Please continue, doctor. I overlapped you.
I mean, sorry, that's okay. So, if possible, to fix to a kind of working environment, to choose the working environment, not to be too ambitious about our career at the cost of our health. So, we need to choose the thing which suits us best, and then fix it there.
Yes. So coming back to Rajendraji's question, while we are traveling on the road and not getting enough sleep, what should we do to avoid acidity? So, I can't avoid travel. I can't avoid sleep. Can I avoid acidity?
So, I mean, if something is very unavoidable, and then we need to choose our diet. So, as I told you, we should take items which are low in oil to avoid sour foods and spicy foods, and take fresh meals, not processed food, and which is stored for more than 3 hours after preparation, like that. These are some simple things to which to guide. So, if even after doing all these things, if you have symptoms, then we are forced to take some pharmacological medicines to treat at that time. For example, this may happen once a week or something. So on that day, maybe you can take an antacid on that day to alleviate those symptoms, and then next day you get back to your routine health and diet.
Great. Thank you so much for answering that question. Nitin Godboleji is from Pune and he has severe cough and gastroscopy done on 23 August. Reports are proximal duodenum erosion, stomach shows erosive gastritis, medicines का course खत्म हो गया है. What do I do to take care or to avoid acid reflux in future?
Yeah. So one another interesting thing which I would want to say is those who have chronic cough. So it may not be a lung issue in all the people. So it can be chronic cough in the presence of normal lungs indicates two problems. One is because of sinusitis, or second thing is because of acid reflux. Okay, so probably they have identified in his case to be because of acid reflux, and they did an endoscopy. So endoscopy is showing some mucosal erosions, some damage here and there. But usually, what we do is we check for some bacterial infection called H. pylori. For those people who
Okay.
have abdominal endoscopy, either ulcers or erosions, we check for this bacterial infection, because that's the most common reason in India, and then in fact, in the entire world, for causing excess acidity and ulcers. So if they check that thing, that's fine. Then we can treat it if it's positive with a course of antibiotics. If it's negative, then again get back to antacid tablets, lifestyle modification, and addressing all the stressors and trigger foods. So if that's not done, then because I don't think we need to do an endoscopy again to identify that infection. We also have some other tests like stool antigen test for H. pylori. This is a stool test by which we can identify H. pylori infection. There is also a breath test to identify H. pylori infection. So we can do these
Yes.
things, and then take it from there.
Correct. So next, Satya Kaushik, 65-year-old female, high gas, hyperacidity, and chest pain, also having blood pressure, high blood pressure. So is there a connection, like how diabetes and other problems do have a connection? Does high blood pressure also have a connection with hyperacidity?
No, it doesn't have. So hypertension is a different problem. It doesn't cause acidity. Only thing is that if their hypertension is not under control, we mistake the symptoms for acidity, and they may be in fact having some cardiac issues. So it causes there is excess incidence of cardiac events in those people who have uncontrolled hypertension. So probably we need to think in that line more than acidity problem, but it's not related
Okay.
directly.
Right, right. So yeah, now let's talk about constipation. Satya and a lot of other people are asking about indigestion and constipation. This is one bracket of questions. The other bracket of questions also are into food खाने के बाद immediately motion होता है या breakfast खाने के बाद होता है. So these are two different set of questions, but I would want you to take questions of bowel
Yes.
related.
Yes. So the bowel movements, either constipation or diarrhea, the most common reason for that thing is something called irritable bowel syndrome. It's called IBS. So this disease is a entity where the symptoms are present for more than 6 months. Usually, they have some kind of abdominal pain or discomfort, and they have either constipation, diarrhea, or a mix of these two things. So the problem is not very clearly understood in medical field. We don't know exactly why it happens, but then there are a lot of things which can aggravate this problem. For example, taking diet low in fiber. For example, if your intake of fruits and vegetables is less, then the intestinal transit becomes very slow. The second thing is about our type of bacteria that are present in the intestine. Everybody has bacteria in their intestines. So if bad bacteria accumulate in the intestines, they cause a lot of bloating, and they may even affect the intestinal movements. The third thing is about our stress and anxiety and depression in our life. So the psyche factors, they also influence our intestinal function. Those who have constipation or diarrhea, for example, if somebody is having an exam or they have to face an interview or something like that, you notice that they are going to washroom frequently, they are urinating, they're passing stool frequently. So that because our sympathetic system and parasympathetic system, they affect the intestinal movements. So we need to address the psyche factors also. So IBS is as again as related to acidity and acid reflux. Again, the same set of rules apply. Those who have more than 50 years, those who had weight loss, they are bleeding, they have bleeding in the stools, or they have lost appetite and weight, or they have a family history of cancers, intestinal cancers. They need to immediately attend and get evaluated, especially in those who are more than 45 years and they have some recent change in bowel habits like constipation or diarrhea. They need to get checked and undergo probably a colonoscopy, where we pass a endoscope from below and check the large intestine. That's a very important thing to do. In other cases where they don't meet these red flags, they don't have any of these alarm symptoms, they can again modify their diet, their lifestyle, and see how it responds. So
Right.
basically
Now,
taking a good amount of fiber. Yeah. Yes.
yeah, sorry, sir. If you're not done with the IBS, please continue.
So basically, the those who have constipation as their predominant problem, they need to take at least 10 to 12 grams of fiber per day. So if you take two portions of fruits, I mean 2 servings of fruits per day after lunch and after dinner, and include a salad in your meal somewhere in the meal, include a salad. So that constitutes good amount of fiber per day.
Right. So, Satya Garu, I think that's what you should do first, rather than taking laxatives every day. Will constipation also have effect on gas and acidity? Does that increase digestive issues?
So when somebody is constipated, technically meaning less than 3 stools per week, or they are straining while passing stool, or they feel that the bowels are not evacuated completely. So these three are the defining features of constipation. So if you meet this criteria, what happens is that if the stool stays for a long time in the large intestine or small intestine, the amount of gas generated also becomes significant. So they also have a lot of bloating and some discomfort, pain, secondary to constipation. So one
Yeah.
significant thing in IBS is they have significant relief after passing stool. That's a defining feature in irritable bowel syndrome, where they have improvement after passing stool. So
Right.
we need to do some measures to make the stool soft and they pass.
Yeah. So next question is Leela Susmi. Leela used to have, she was under hormonal tablets, and from then on, I have the gastric issue, which for which I've been using antacids for a very long time. Please let me know how to reduce the gastric issues, and are there any side effects for long-term usage?
So some medicines, especially progesterone, they cause a lot of gas formation, acidity, and acid reflux. Because we noticed that in pregnancy, people complain of a lot of acid reflux. That's because of progesterone hormone, which is naturally present. So we need to address the necessity of continuing hormone replacement therapy. Number one. Number two is the dosage of hormones which you are taking. Number three is co-administration of antacids. So probably she's taking antacids for quite some time. We also need to check our body weight. That's a very important thing. Those who are overweight or obese, they have a tendency for a lot of acid reflux and acidity formation. So we need to get into the ideal body weight. One simple formula is to subtract 100 from your height in centimeters, and you'll get your ideal body weight.
Yeah. Sonia is asking another question here. Does taking whey protein and creatine leads to gut indigestion issues despite taking enough water? And what tests can I take to understand my gut health?
So taking whey protein and creatine, they are actually not harmful to the gut bacteria. Whey protein adds significantly to our muscle mass. So somebody is not able to make a diet chart and stick to that thing. If they're not taking adequate protein in their diet, supplementing with good quality whey protein is always okay. It's acceptable. There is no problem with that thing. It won't cause any gas formation or anything. About creatine also, it's not very clear, but creatine actually increases our ability to do exercise to gain muscle strength. It's not shown to be very harmful in scientific evidence.
Right, right. Okay, sir, सुशील सिंह है, hepatitis B है इनका positive, and SGPT sometimes is low, sometimes is really very high, and somebody also SGPT का variation पूछा है, 3 महीने पहले किया है कम था, अभी किया है तो suddenly बढ़ गया है. So what does this say, and especially with hepatitis B, how long do you have to monitor?
So if somebody is having hepatitis B infection and has abnormal SGPT, we need to check the viral load, hepatitis B viral load, to identify that the virus is actually causing abnormal LFT, because there are several reasons why LFT can be abnormal. The most common reason is actually more than hepatitis B is something called fatty liver disease. So if somebody is obese and has a lot of fat in the liver, that can cause hepatitis. So if the viral load
जी.
is high, then we can attribute it to the virus. If the viral load is low or less than treatable limit, then probably we need to look at other causes like alcohol, fatty liver, medications, all these things.
Yeah. And now, pain in the abdomen is something that we want to talk about. A lot of people have been asking that I get up with a pain of abdomen, especially towards the right side. Where did I miss the question? So many people have repeated their questions. Yes, AM Creations, left side abdomen pain, is it gas or it's just under the chest? And right side abdomen pain. After the stool, my pain is relieved. A lot of questions. So can we, too many questions there. Can we bunch all of them up? Understand when is an abdomen pain an indicator for something wrong in the gut?
Yeah. So as I told you, if we see 100 patients with this problem, abdominal pain, around 60% of the people will have IBS or functional dyspepsia, acidity, or IBS. So, remaining 30% of people, we need to work up for specific causes. For example, if the pain
G.
is relieved after passing stool, it's a strong pointer towards IBS, irritable bowel syndrome. If the pain is located in the right side of the upper quadrant of abdomen, then there are few reasons for that thing apart from IBS. So somebody may be having stones in the gallbladder. It's called biliary pain, where the pain is kind of a crampy pain. They have a, squeezing kind of pain which lasts for a few minutes, and it stays specifically in the center or on the right side of upper abdomen, and then it disappears either spontaneously or taking with some antacids and anti analgesic medications or something. Okay, so right side pain, we need to rule out gallbladder stones. The left side pain again is most likely because of acidity, more than any serious disease in the abdomen. The
Okay.
pain which is diffuse in the abdomen is most likely due to IBS. So if somebody's pain is in the center and it's going to the back, it's going to the spine, then it may be because of pancreatic problem. Because the pancreas is located deep in the abdomen and near to the spine. So they have pain coming in the front and going to the back. So if the pain is continuous coming in the front and going to the back, then we actually need to go to urgently and get evaluated for pancreatic problems. If the pain is in the lower abdomen, the most common reason is some infection in the urinary bladder. It's called cystitis. It happens most likely in diabetics or sexually active young women. The other reasons are appendicitis. If the pain is happens in the right side of lower abdomen, it starts in the center and then goes to the right side of lower abdomen. It most likely is appendicitis. Okay. There are other gynecological problems also which can cause pain in the lower abdomen.
Right. So it's so important to understand where your pain is. Locate the pain, see how it is traveling, three, how it is coming on and fading out. So
Exactly.
these are the ones that you need to keep in mind. And people, I think you've got to mark this episode, cut this portion, and then understand where your pain is and then consult accordingly. Thank you so much, Dr. Bharath here. And next question that I want to take is Frazil D'Souza. Frazil has acidity and gas issues since COVID in 2020. Consulted many doctors, done an endoscopy also. Reports are all normal. But when I wake up in the morning, even now, I have back pain, and after passing motion, it goes off. And she has been colonoscopy also has been done. Report is normal. But when I eat foods like mango, watermelon, cucumber, after an hour, I get bitter burps. Please suggest me remedy.
So this is one important problem which we have noticed after COVID. So any viral illness, it can actually reset the intestinal system significantly. So some people can have abdominal pain, some people can have acid reflux, some people can have constipation, some people can have diarrhea. So there is a lot of evidence to prove that viral infections changes the intestinal function a lot. So what we need to do now is to identify other reasons for these problems. For example, I think she has undergone a lot of evaluation already. So I think
Yes.
presumably all those tests are normal for her. So it means that there is some disturbance in the intestinal function only. There is no problem in the structure of the intestine. So what she needs to do is to make a diet plan first. Identify the trigger foods. Make a strict diet plan about what foods need to be avoided, what foods are okay. Because she clearly mentions about some specific things in the diet which
Mango,
aggravate her symptoms. Yeah,
yeah,
they are called trigger foods for her. So they need to be set aside. Even though some
right.
food like cucumber is good, in her case it's causing a lot of burps. So that's a trigger food for her. So we need to avoid that thing for some time. The third thing is also some medications may help her selectively to improve her symptoms. For example, a course of probiotics, they actually change the gut function again. They aid in development of good bacteria in the intestine. They reduce bloating. They normalize the intestinal bowel movements frequency. She also needs to work on her lifestyle and psyche aspects also, apart from pharmacotherapy. So
Okay,
it's a
okay.
multi-pronged approach. It's not necessarily pharmacology or diet alone.
Right. So, సత్యసాయి గారు కాన్స్టిపేషన్ గురించి కంటిన్యూస్ గా అడుగుతూనే ఉన్నారు. మీరు ఆల్రెడీ మాట్లాడారు, యూ ఆల్రెడీ గివెన్ ఇన్పుట్స్, బట్ మేబీ ఇన్ తెలుగు ఇఫ్ యూ క్యాన్ కంటిన్యూ. 2 weeks నుంచి వారికి మోషన్స్ అవ్వలేదు అండ్ హీస్ stomach is very tight. Please give me suggestions. Doctors told him to get endoscopy reports. మరి ఎందుకు ఆగుతున్నారు? కొంతమందికి భయం ఉంటుందని ఇందాక మీరు చెప్పారు. క్విక్ ఆన్సర్ ఇన్ తెలుగు ఫర్ హిమ్
మీరు
ప్లీజ్.
మీ ఏజ్ ఎంత సత్యనారాయణ గారు?
Yeah, we will
Did you
wait for
mention
his
it?
answer. No, he does not. He did not. Most of the people
Yeah.
in the anxiety, they don't mention their gender and age.
So
And other
పీపుల్ విత్ షుగర్ ప్రాబ్లం ఉన్న వాళ్ళకి ఈ ప్రాబ్లం చాలా ఉంటుందండి. ఇన్ కేస్ మీరు డయాబెటీస్ ఉంటే మీకు ఒకసారి షుగర్ కంట్రోల్ ఎలా ఉందో చెక్ చేయాలి. ఇన్ కేస్ మీరు ఇంతవరకు ఏం టెస్ట్ చేయలేదంటే బ్లడ్ షుగర్, ఫాస్టింగ్ బ్లడ్ షుగర్, థైరాయిడ్ టెస్ట్, ఇవి టెస్ట్ చేసి చూడాలండి. సో ఇవి మెటబాలిక్ ప్రాబ్లమ్స్ అంటారు. మన బాడీలో మిగతా హార్మోన్స్, అదర్ సిస్టమ్స్ వర్క్ చేయడం వల్ల ప్రాబ్లమ్స్ వల్ల కూడా మన పేగు కదలికలు అవన్నీ అఫెక్ట్ అవుతాయి. సో, మనం జనరల్ చెకప్ చేయాలి. ఎండోస్కోపీస్ అనేటివి తర్వాత అండి. వాటి గురించి భయపడకండి. ఫస్ట్ మన మెటబాలిక్ సిస్టమ్ ఎట్లా ఉంది బాడీలో చెక్ చేయాలి. సెకండ్ థింగ్ ఈస్ మీ డైట్ ఎలా తీసుకుంటున్నారో ఒకసారి డైటీషియన్‌ని కన్సల్ట్ చేయాలి. ఆహారంలో పీచు పదార్థము సరైన మోతాదులో తీసుకుంటున్నారా లేదా అనేది చూడాలి. అండ్ కొన్ని ఐటెమ్స్ వల్ల గ్యాస్ ఫార్మేషన్ ఎక్కువవుతుంది. ఆ ఐటెమ్స్‌ని అవాయిడ్ చేస్తున్నారా? ఎలా ఉంది మీ డైట్ అనేది డీటెయిల్డ్‌గా మీకు హిస్టరీ తీసుకోవాలి. మీ దగ్గర నుంచి ఎలా తీసుకుంటున్నారు డైట్? మీ టైమింగ్ ఏంటి? అమౌంట్ ఆఫ్ మీల్స్ ఏం తీసుకుంటున్నారు? అవన్నీ చెక్ చేయాలండి. అండ్ కొన్ని జనరల్ చెకప్ కంపల్సరీ చేయాలి. షుగర్, థైరాయిడ్, బ్లడ్ కౌంట్స్, అల్ట్రాసౌండ్ స్కాన్ ఇవన్నీ చేసి చూడాలండి.
Yeah, right. So that's the answer for you. And Shashi Kumar ji is 67-year-old, undergone a lab gastro jejunostomy on 24th of November. Now getting bloating problem after the after the surgery. Can you please suggest any remedies?
Yeah. So after the gastrojejunostomy surgery, so the bile gets directly access into the stomach rather than going into the small intestine. It's bypassed and a tract is created to come into the stomach. So some people experience a lot of acidity, bloating because of this problem. So for some time, he may benefit with antacid medications. And we also need to change the meals a bit. We need to take small, frequent meals rather than heavy meals as we used to take before, like three meals. Instead, we have to split the meals and make it into small, frequent meals. If this symptom doesn't resolve with these changes in the diet, then we need to take a deeper examination of the problem. Some people have something called rapid transit of food from the stomach into the intestine, causing problems. So we need to consult the surgeon and again reevaluate what is exactly causing the problem. So initially, some changes in diet, some medications, and then if a problem is persisting, then we need to evaluate it in a bit of detail.
Right. So there are two questions about, a discomfort in breathing along with gas and acidity, especially in the night, that they are unable to breathe properly. There is burning and there is bloating as well. And also, there's another question, JR62 female, I have a burning sensation in the throat and heaviness in the stomach. I'm finding it very difficult to breathe in such episodes. Is it acidity and gas which is causing it, or any other pulmonological issues? Then also same Anish, 17-year-old male, lot of bloating discomfort in the back. A lot of people are saying that there's discomfort in the back. Trouble sleeping straight. Is it irritable bowel syndrome?
So, I mean, those who have acid reflux, a lot of people complain that the pain is going to the back because the foot pipe is located in the near the spine. So all the radiation happens in the direction. So it can go to the neck, it can go to the back. The second thing is people having shortness of breath or breathing difficulty. So it can be due to two reasons. One reason is because the acidity in the night time, in the morning time, we are actually upright. So the gravity takes care of some part of acidity which is coming back. So when we are horizontal in the night, the acid reflux is significant. So what happens is that some people, because of acid reflux, the refluxed liquid it goes into the airway and disturbs the airway. So they can have something like an asthmatic episode in the night. So late onset adult asthma, always we need to rule out acid reflux. They can also have a lot of cough and breathing difficulty because of acid reflux. Okay, so that
Right.
part is very important to address.
All right.
So
Thank you, doctor. I think we've answered most of the questions. But if you think there are any questions or anything that we can place before Dr. Bharat, he's available on Apollo 24/7's consultation link. We have put Dr. Bharat's consultation link in the chat box. Please do consult. Due to paucity of time, doctor, I will not be able to take further questions. So I will have to wind up the show here. But I would request you to kindly give us top tips to address gas and acidity on a normal day-to-day basis.
some thank you, Jansi madam. So some advice about what items to take and what items in the food to avoid, and how to maintain a healthy lifestyle and avoid gas and acidity problems. I'll give a few things to help people in general. So number one is take foods which are holistic and healthy, like whole grains, cereals, milk, milk products, and then avoid things which are uh, very acidic, like sour foods, spicy foods, which contain excess oil and which are prepared by artificial processing or which are prepared more than 3 hours ago, which are stored and then eaten. So foods which are good to take, foods which are to be avoided. The second thing is to maintain a good sleep pattern. So at least 5 to 6 hours of sound sleep is necessary for maintaining good gut health. The third thing is to have a program of exercise, at least 30 minutes of exercise per day. It prevents acid reflux significantly to the tune of 60% in one study. Fourth thing is to maintain a sound and healthy mind, a very relaxed mind. So, because mind in the form of anxiety or depression, mental problems, they can affect intestinal function a lot. So, with these few things, we can actually aim to have a healthy gut, and we need to take a consultation of a physician or gastroenterologist in case it persists beyond taking all these simple precautions, and then if it persists, we need to consult, and in the presence of alarm symptoms. Thank you.
Wonderful. Thank you so much, Dr. Bharath, for this elaborate discussion. I know that the topic is vast, Mahasamudram antan nenu, but still we've managed to address most of the concerns through your
Thank you.
insightful information. Thank you so much. Appreciate your presence on Sunday morning. Thank you
Thank
once
you.
again. Namaskar.
It's a privilege. Thank you.
Thank you. And that is Dr. Bharath Kumar, a gastroenterologist and interventional endoscopist. Now it's your time to answer our questions. This is the health quiz. I'm going to ask you three questions. Please answer the questions over chat. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And winners, you have to write with your contact details at marketing@apollo247.com. All your details have to reach us before Wednesday. May I mention that you need to write your name, contact number, and address to marketing@apollo247.com before Wednesday. Gift vouchers will be shared with you. Chaliye, the questions on your screen now. The first question for today is fill in the blanks. One significant cause of excess gas is swallowing too much of what? A blank R. What is that word? Please fill in the blank. One significant cause of excess gas is swallowing too much of what? Question number two. True or false? Lifestyle changes may be helpful in reducing the symptoms for gas or acidity. True or false? Lifestyle changes may be helpful in reducing symptoms for gas or acidity. Question number three, yes or no mein answer kijiye. Acid reflux and gas arise from problems in the digestive system. Yes or no? Acid reflux and gas arise from the problems in the digestive system. These are the three questions for today. Go on, answer your questions in the YouTube chat box, and we are looking out for the winners today. In the meanwhile, let me give you the gift coupons that you can use on Apollo 24/7. Download Apollo 24/7 and use the coupons that I'm going to give you. And the first one that we give you is AskDoc150. The code is ASKDOC150. Consult top doctors direct from Apollo at 150 rupees and get 150 rupees cash back on online doctor consultation. The next one that we give is code FIRST3, FIRST3. You order medicines direct from Apollo and get 25% off on online medicine orders, and get a 2-hour delivery as well if you order from Apollo 24/7. Download the app right away and use this code, which is exclusive for our health our viewers. The code is HH247. Get up to 199 off on online consultations with Apollo doctors and up to 20% off on medicine orders. This can be used in addition to the other coupons that we have shared a little earlier. So these are the coupons, and you know that Apollo 24/7 now can be accessed from WhatsApp as well. You can call or text or WhatsApp PKJ 9355247247 per to avail healthcare services just like you do on the Apollo 24/7 app as well. So these are the coupons that we have given away. Next week, we are talking about ovarian cysts. The cysts in the ovary, which can cause problems, which can be painful pain, which can cause issues with fertility and other menstrual problems. So let's talk about treatment and management of ovarian cysts in women. So this is going to be the next week's topic. Join us next week, 11 a.m. on Apollo 24/7's Health Hour, and I am looking for our winners to be announced. The winners are Satish, Mohammad Javed, Ritvik, and Jasrita. The winners are Satish, Mohammad Javed, Ritvik, and Jasrita. These are the winners for today. So next week we are going to talk about ovarian cysts. तो थैंक यू ऑल फॉर जॉइनिंग अस ऑन दिस संडे मॉर्निंग. फिर मिलते हैं. कीप जॉइनिंग अस ऑन द लाइव सेशन वेयर यू गेट अ लॉट ऑफ इंफॉर्मेशन. थैंक यू. नमस्कार.